People often ask me why it is that doctors and chiros or physical therapists or physiotherapists or any other type of person, healing profession, doesn't understand what PRI is talking about. The reason is simple, because it's not taught, that's first, but the biggest thing is people don't recognize patterns. And once I can't even have a discussion with someone else who knows a lot about the human body. They all know a lot about the human body. But when you don't recognize a pattern as the underlying issue, you're completely talking past each other. I mean, it's like having a atheist and an evangelical Christian trying to have a conversation about the meaning of life or about the purpose of life. You know, it's just two completely different viewpoints. Their consciousness is so different that you can't talk to each other. And that's the position that I often find myself in, trying to explain this to not only medical professionals, but to the general public. And in actuality, it might be easier to talk to the general public who doesn't have any emotional investment or educational investment in how they were taught before, because it's hard to go through school, spend $100,000 on physical therapy school or something like that, and then realize, geez, everything they taught us is kind of not applicable because we're not straight, we're not symmetrical. And once you're in a pattern, all those assumptions about what muscles do and don't do, that would be true, all that stuff would be true if you were straight and symmetrical and dead, most likely, without a brain putting you into a pattern. But once someone is in a pattern, all bets are off. All muscle function has to be altered by definition because you're in a pattern of right stance. If you're not living in the middle, if you're not living symmetrically in the middle, which we know almost none of us are going to be, not completely at least, we just want to reduce those asymmetries back to an acceptable amount. Once you're in a pattern, shoulder muscles and scapular muscles, they don't work in the same way until you have a rib cage that is fully expandable with air and a pelvis that's positioned properly, and femurs that can abduct and adduct, and a spine that can flex and extend, and heads that can rotate, necks that can rotate and side bend. Until you can do that, everything that you've been taught previously is not applicable. So you have to unlearn what you've learned, and that really takes a complete change of consciousness. So it's just like dancing. When I teach salsa, and I've done that for 15 years, if someone tells me, oh yeah, I dance, I danced my whole life, that's harder to teach them because they're going to have habits that they can't break out of. I'd rather take someone that knows nothing about dancing and start with them from a blank slate. And that's really, with PRI, with people that I work with, it's kind of easier to work with people that know nothing about the body, except maybe they work out, but they don't have any inherent or emotional investment in what they've previously learned. So they have no real consciousness that has to be completely removed, inhibited, and then built back up. They're open to new ideas, so it's really good. And so a lot of times, like a gentleman I talked to from Illinois 2 nights ago, he's like, people kept telling me that what I was feeling inside, the twisting that I felt inside was impossible. He obviously it's not. He was accurately reporting what he was feeling, and he is stuck to the right. So he knew that he was in a pattern without even knowing he was in a pattern, and he used to feel like 70% of his weight on the right foot. So he had it perfectly identified that he's stuck in right stance, but he didn't know what he was looking at. So people see asymmetries, they just don't know what the origin of it is, and they don't understand that it's a pattern. And until you can understand it's a pattern, you don't know how to treat it effectively, and that's why so much treatment fails. And that brings me to the point that when people get treated ineffectively, and they see massage therapists, they see chiros, they see physical therapists, they see doctors, they see every type of medical professional, and they all try to help them as best they can, but a lot of times it just doesn't work. And all treatment, well, usually you would hope is well-meaning. They're doing the best that they can with the knowledge that they're working upon. I was the same way. Like, before I understood PRI, I did the best I can with the knowledge that I had. Turns out most of the knowledge I had was not that great. So, from a person's standpoint who's been going through this for so long, and if the pain, especially if the pain has been continuing, and sometimes it would get a little better and then it would come back, and nothing ever really worked long term. And that pain keeps increasing or simply never goes away, and it really starts interfering with your life. At that point, you're open to other ideas. A lot of people don't want to take any type of drugs, but sometimes people don't have the time to devote to researching their own issues. They don't have time to get onto YouTube and read and do all these things and find me and find other types of PRI people who can actually give them an explanation for what they're feeling and what's going on in their body. And at that point, drugs are an option. And it just brings me to I was watching this documentary on Netflix called The Pharmacist, and it was just painful to watch. And it's about this pharmacist down in New Orleans who was watching the rise of prescription painkillers in the late 90s and early 2000s, when I guess it was Oxycontin was really being marketed heavily by Purdue Pharma, I think they were. And it turned out that there were doctors who would make it a business just to prescribe pain pills, and people would pay them a premium to get these drugs. Now, of course, Purdue Pharma was saying, no, it's not addictive. It's very rare that it's addictive, and everything will be okay. And these are so powerful that you can go 12 hours without pain or with pain relief. And of course, people get addicted to them, and then they have to keep going back and keep going back and keep going back. Now, whether physical pain or emotional pain was the basis of their addiction, it's impossible to say. But when it's physical pain, and again, they're not really separable, because when you have enough physical pain, from experience, when you have enough physical pain that goes on for long enough, and you see no future for yourself. I was in my mid-20s. I was supposed to be in the prime of my life, and I could barely move. I couldn't stand up for 4.5 years for longer than 5 minutes without intense pain in my feet. And then the SI joint spasms, the SI joint blowouts where I couldn't stand up for a week and a half, and then I would still be very acutely aware of that SI joint for another 2 weeks after that. And then neck spasms continuously, 3 or 4 neck spasms a year, where the type where you're like this, and you can't turn your head, so you have to turn your whole body, and it's just insanely painful. So all of those things, so the plantar fasciitis where I couldn't stand up, the SI joints, the neck spasms, still had ringing in my ears really loudly. It was a pretty depressing time in my life. And then you have isolation. No one understands what you're talking about. I don't even think people believe you half the time, because you look like you're in shape. People say, you shouldn't be in pain. Why would you be in pain? That is the worst thing. That is the worst thing you can say to someone who's in pain is, you're in shape. You shouldn't be in pain, or why are you in pain? If they knew why they were in pain, they wouldn't be in pain. They would have an answer, and they would be doing it. So there's a social isolation and emotional suffering and downright depression. And can it get to the point of suicidal thoughts? Absolutely. I've been there. Not something I talk about often, but I was there. If I knew at that point in time that drugs were available, opioids were available, I just didn't even know. Thinking back, could I have gotten addicted to opioids? Absolutely. No doubt in my mind. Because there's absolutely nothing you won't do when you're desperate enough for that pain to go away, just at least temporarily. Because it just wears you down. So the Pharmacist, getting back to the documentary, so it's personal to me because I can see myself in those people, in the patients who used to get these drugs. The Pharmacist he was trying to get these pill mills shut down. And he was largely successful, and there were successful prosecutions in Louisiana and New Orleans and then elsewhere throughout the country. But the problem was, once the Oxycontin was no longer available, a lot of the people just turned to heroin. because there was no effective way of getting rid of their pain or whatever they were going through, emotional or physical. And I just think, it just makes me think of the amount of people who are struggling, who are suffering every day with pain, with physical pain, chronic pain, who don't know about postural restoration, who don't know that there are explanations for what they are going through. And I realize I'm in the United States and I get a lot of emails from people all over the world, especially in India, China, Europe. I've gotten for Africa, South America, and I realize what I can do is very limited, and that pains me to know that, because everyone is a little bit different. I can speak in generalities about what patterns are and what you'll find, but there are so many variables, conditions that people don't understand that can go into these patterns. And so it's, without me working one-on-one with someone, I can't. And even then, like the girl I didn't know, who I'm personal friends with, I didn't know she grinds her teeth. There's little things like that that can make all the difference to how strongly someone is patterned. And I know PRI is changing things, I know it's spreading, and I'm just making a personal plea to people out there. Every time that you watch a video, if you like it or comment or share it, it is spreading the word. People have hope. When people tell me that I've saved their life, and I haven't done anything, all I did was share what PRI is teaching. It's not me. That I've given them hope. People need that really, really badly. So if you can share a video, like, comment, do anything that YouTube will decide that this is an important video to show, more people are exposed to it. And if you're concerned about public health in the United States and suicide and depression and happiness and drug abuse, if those are things that are important to you and you'd like to see those decrease, I'm not saying PRI changes every single thing with every single person, but for so many people, it is the missing piece of the puzzle because no one is understanding that the underlying issue is a pattern of neuromuscular pattern of behavior, of movement that people don't know they're in, no one else knows they're in, and they can't get out of anyway. And so anytime you can spread that message, I would really appreciate it, because this is something that is unbelievably dear to my heart. So, thanks.